Welcome to the class. So today we will start with the biophysics module. It's a recall and revise series. And here we have got recall questions from the biophysics, and one by one you will solve these questions. Okay, Dr. Sinchana, can you start first three slides you can take? Okay.
Yes, sir. Which type of atom is primarily involved in generating images during magnetic resonance imaging? A. Carbon, B. Oxygen, C. Hydrogen, D. Nitrogen, E. Sodium. Actually, I don't know about this. Is it E. Sodium?
Hydrogen.
Hydrogen.
Yes, hydrogen is correct. Next.
What type of treatment involves inserting a device into the vagina to deliver radiotherapy? A. External beam radiotherapy. B. Systemic radiotherapy. C. Brachytherapy. D. Cyberknife therapy. E. Proton beam therapy. It is C. Brachytherapy.
Correct. Correct.
Yes.
So question number 1 is C, hydrogen. MRI primarily detects the magnetic properties of hydrogen nuclei protons in the water and fat. Since the human body is mostly water, hydrogen is abundant and ideal for generating detailed images. Okay. And C, answer is brachytherapy. We know that the source is kept in the vagina or near to the tumor. Okay. In gynecological cancer, this is done by inserting the device into the vagina. Dr. Sinchana, continue. Next question.
Which type of electrosurgery involves placing a written electrode pad under patient's body part? A. Bipolar electrosurgery. B. Monopolar electrosurgery. C. Cryosurgery. D. Laser ablation. E. Ultrasonic dissection. It is B. Monopolar electrosurgery.
Correct. Next.
Which ultrasound-based process can cause cell lysis and tissue damage due to mechanical effects? A. Reflection. B. Refraction. C. Cavitation. D. Attenuation. E. Acoustic shadowing.
Acoustic shadowing.
I don't know this. Refraction. B. Reflection.
No, wrong. Okay, we'll see the answer. Okay, so question number 3, answer is monopolar electrosurgery. Monopolar electrosurgery requires a grounding pad to complete the electrical circuit. The active electrode applies current and the pad safely returns it. Okay. Question number 4 is a C, that is cavitation. Cavitation refers to the formation and collapse of microbubbles in the tissue due to ultrasound waves, which can cause cellular damage or lysis. This question has been asked, so please remember these things, something about ultrasonography and related to it. Okay?
Yes.
Next.
CO2 laser is preferred in endometriosis treatment because A. It causes deep tissue damage. B. It is cheaper than electrocautery. C. It causes minimal thermal damage. D. It can coagulate large vessels. E. It penetrates deep tissue. E. It penetrates deep tissue.
Actually, the lateral spread is less, so minimal thermal damage is actually the answer. Okay. Let's see. Next.
What is the typical frequency used in transvaginal sonography probes? A 1 to 2 megahertz, B 2 to 3 megahertz, C 3 to 5 megahertz, D 5 to 7.5 megahertz, E 7.5 to 10 megahertz.
For
3 to 5
TBS,
megahertz.
it requires higher
5 to 7.5.
Then 5 to 7.5.
7.5 to 10 actually.
Okay.
So question number 5 is C. It causes minimal thermal damage. CO2 lasers are precise and cause minimal collateral thermal damage, making them suitable for delicate surgeries like endometriosis treatment. Okay. Question number 6 is 7.5 to 10 megahertz. TBS probes uses high frequency ultrasound, that is 7.5 to 10 megahertz, to provide high resolution images of pelvic organs as they are placed close to the target area. Okay. Dr. Amrita, next 3 slides.
Yes, sir. Question 7. Piezoelectric crystals are primarily used in which medical device? A. CT scanner. B. MRI machine. C. Ultrasound transducer. D. X-ray tube. E. Defibrillator. Sir, C. Ultrasound transducer.
Ultrasound transducer.
Ultrasound transducer.
Yes.
Yes.
Next.
Question 8. Which physical property of ultrasound waves is primarily responsible for generating images by returning echoes from tissue interfaces? A. Refraction. B. Diffraction. C. Absorption. D. Attenuation. E. Reflection. Sir, reflection.
D,
Yeah.
attenuation.
No, it's a reflection. Okay. So because
Reflection.
yeah, we'll see the explanation. So question number 7 is ultrasound transducer. Piezoelectric crystals in ultrasound transducers generate sound waves when electrically stimulated and convert returning echoes into the electrical signals. Question number 8 is E reflection. Reflection of sound waves at interfaces between the tissues of different densities allows formation of an image on the ultrasound monitor. Okay, so it is the reflection of sound waves at the interface between the tissues of different densities. So tissues have different densities that allows the formation of image. So you can read this question number 8 clearly, properly. Which physical property of the ultrasound waves is primarily responsible for generating images by returning echoes from the tissue interfaces? Okay, so the echoes are returning from the tissue interfaces, that is the reflection. Dr. Amrita, continue.
Yes, sir. Question 9. Which ultrasound imaging property depends upon the ability to distinguish two structures along the path of the sound beam? A. Temporal resolution. B. Lateral resolution. C. Axial resolution. D. Contrast resolution. E. Frame rate. Sir, I don't know.
Which ultrasound imaging property depends on the ability to distinguish two structures along the path of the sound beam? So the sound beam is passing through a path, and there are two structures which we need to differentiate. So which of these will be?
Temporal.
Contrast resolution.
No, it's an axial resolution. Okay,
Hmm.
it's axial resolution. Next.
Question 10. On ultrasound, what term is used to describe a dark or a black area where no echoes are returned from the structure? A. Echogenic. B. Hyperechoic. C. Isoechoic. D. Anechoic. E. Hypoechoic. Black is
Anechoic.
anechoic.
Correct.
Black
Correct.
is
Okay.
anechoic.
Correct. So question number 9 is axial resolution. Axial resolution depends on the spatial pulse length and is key to differentiating structures along the ultrasound beam's axis. Okay. Next is question number 10 is anechoic. Anechoic areas appear black and represent fluid filled structures that do not reflect ultrasound waves. Next, Dr. Amrita.
Question 11. A 14-year-old girl is undergoing radiotherapy. Which of the following tissues is the most resistant to radiotherapy? A. Bone marrow. B. Lymphoid tissue. C. Gastrointestinal epithelium. D. Cartilage. E. Hair follicles. So cartilage. D.
Cartilage.
Cartilage.
Yeah. Actually, those who have a high mitotic will be sensitive. Those who will have a low mitotic, this will be less sensitive. Okay. Next question.
Yes. Question 12. Hysterosalpingography (HSG) is ideally performed on which day of the menstrual cycle? Option A, day 1 to 3. Option B, day 5 to 9. Option C, 12 to 14. Option D, 16 to 18. Option E, 20 to 24. Sir,
5 to 9.
option 5 to 9, but yes, 5 to 9. It's on the 8th
Yes.
day.
Yeah.
8th.
After the periods, but before 9th day we perform. No. So 5 to 9. That
Yes.
is option B is going to be correct. So question number 11 is a D. Cartilage is highly radio resistant due to its low mitotic activity and poor vascularity. Question 12 is B, that is 5 to 9. HSG is done between day 5 to day 9 of the cycle to avoid pregnancy and ensure optimal endometrial conditions for imaging. Dr. Sinchana, you take next 3 slides
Yes,
now.
sir. A single chest X-ray is approximately equivalent to how much natural background radiation? A 1 day, B 10 days, C 1 month, D 6 months, E 1 year. Actually,
1 month.
10 days. B. don't know, sir.
Yes, 10 days. It's a 10 days. A single X-ray test is approximately equivalent to natural background radiation of 10 days. Next question.
Which of the following diagnostic tests deliver the highest radiation dose? A. Chest X-ray, B. Mammography, C. CT, abdomen and pelvis, D. IVP, and E. Barium swallow.
CT.
C. CT.
Correct. CT, abdomen and pelvis. Actually, all these questions are recall questions. They have been asked multiple times. Okay, so please concentrate. So, X-ray chest delivers around 0.1 MSV of radiation, equivalent to about 10 days of natural background exposure. Question number 14 is CT abdo-pelvis. CT of the abdomen and pelvis delivers one of the highest doses of medical radiation, around 10 to 20 MSV per scan. Okay. Continue, Dr. Sinchana.
What is the SI unit commonly used associated with power output used in diathermy? A. Watt, B. Ohm, C. Joule, D. Ampere, E. Volt. C. Joule, diathermy.
Diathermy, what we use? SI unit for power output. It's
Ampere.
watt. It's watt.
Okay.
Next.
Which of the following methods is used to interpret a DEXA scan report in postmenopausal women to assess osteoporosis risk? A. Bone age score, B. T score, C. Z score, D. trabecular volume ratio, E. bone turnover index, C. Z score.
What is the question?
Osteoporosis risk by DEXA
T
scan.
score.
It's T score. They are asking in the postmenopausal women.
Okay.
Postmenopausal,
T
it is a
score.
T score. Okay. So question number 15 is watt. Diathermy involves the use of high frequency electromagnetic currents to generate heat in body tissues. The SI unit for power, which reflects the rate at which energy is delivered or consumed, is the watt. Diathermy machines are typically rated in watts to describe their power output. Okay. Question number 16, answer is T score. So DEXA, dual energy X-ray absorptiometry, is the gold standard for measuring bone mineral density. The results are reported using T scores and Z scores depending upon the population assessed. Okay. So T score compares a person's BMD with the average peak BMD of a young, healthy adult of the same sex. Okay. So T score will compare person's BMD with the average peak BMD of a young, healthy adult of the same sex. It is used for postmenopausal women and men over 50 years. WHO criteria for interpretation, again, these are the SBS most of the time. T score more than or equal to -1. Osteopenia, when T score is between -1 and -2.5. Osteoporosis, when T score is less than or equal to -2.5. And severe osteoporosis, T score is less than -2.5 along with fragility fractures. Okay, so they may give you any of the score and they may ask you the interpretation. Okay, now coming to the Z score, it compares the BMD with that of a person of the same age, sex, and body size. Okay, it is used for premenopausal women and men under 50 and children. Z score less than -2 is considered below the expected range for the age. You understood now?
Yes, sir.
Yes, sir.
Next question.
In ultrasonography, what does acoustic impedance primarily depend on?
There are many
Frequency.
questions on ultrasonography, so please go through the properties of ultrasound. Okay.
Yes.
Yeah.
A. Frequency of ultrasound wave. B. Angle of insonation. C. Density and speed of sound in the tissue. D. Distance from the probe. E. Wavelength of the ultrasound beam. C. Density and speed of sound in the tissue.
Yes. In ultrasonography, what does acoustic impedance primarily depend on? So it is the density and speed of the sound in the tissue. Okay. So answer is C, density and speed of the sound in the tissue. Acoustic impedance Z is a property of the tissue that determines how much resistance an ultrasound wave encounters as it travels through the tissue. It is defined as Z equal to P into C, where P is the density of the tissue, that is kg per meter cube, and C is the speed of the sound in the tissue, that is meter per second. Impedance mismatch between the two tissues causes reflection of the ultrasound waves at their boundary. This is the basis for image formation in ultrasound. Okay, so these basic properties of ultrasound, please go through. Okay, high impedance difference will lead to more reflection. Example, soft tissue, bone interface, etc. And low impedance difference, there will be more transmission, and examples are soft tissue interface. Okay, so that is about. Next, Dr. Amrita now.
Yes. What is the approximate radiation dose to breast tissue during a CT pulmonary angiography in a young female patient? Option A, 0.1 microgyri. Option B, 1 to 2 microgyri. C, 5 to 10 microgyri. D, 20 to 30 microgyri. E, more than 50 microgyri. Sir, option C.
5 to 10.
It's 20 to 30 mcgy. Answer is 20 to 30 mcgy. CTPA is a diagnostic test to evaluate pulmonary embolism, which exposes the breast tissue, especially in young females, to a relatively high dose of ionizing radiation. The best breast dose during CTPA ranges from 20 to 60 milligray, depending on scanner settings, patient size, and technique. Young female patients are particularly sensitive to radiation-induced breast cancer risk. Alternatives like V/Q scanning may be considered in patients or younger or pregnant patients due to lower breast radiation. Okay, so CTPA causes, we have to see to it that the radiation is less. Next.
Question 19. A filthy clip commonly used for laparoscopic tubal sterilization is made up of which of the following materials? A, steel. B, titanium. C, silastic. D, nylon. E, polypropylene. So, silastic.
Titanium.
Yes, titanium is the correct answer. These Felshi's clip are made up of titanium. Okay, so the answer is B, titanium. The Felshi's clip is a small spring-loaded clip used for permanent female sterilization by occluding the fallopian tubes. It is made up of titanium, a biocompatible, non-corrosive metal lined with sialistic or silicone rubber insert to prevent trauma to the tubes, applied laparoscopically, and causes tubal occlusion by crushing the tubal lumen. This method is known for low failure rates, minimal tissue damage, and is reversible in some cases. Okay, so remember that titanium is the answer. This is also one of the frequently asked questions. Next question, Dr. Amrita.
Question 20. Radiotherapy at bone marrow. Which of the following blood cells is least affected by radiation? Option A, lymphocytes. Option B, hematopoietic stem cells. Option C, epithelial cells of the GI tract. Option D, neurons. Option E, granulocyte precursors. Sir, option D, neuron.
The neurons.
Correct. Again, these are not dividing permanent cells, so they will have less or they will be radio resistance. So D, neurons is the answer. Radiotherapy primarily affects rapidly dividing cells, which are more radiosensitive. This include hematopoietic stem cells, lymphocytes, epithelial cells of mucosal surfaces. Neurons, on the other hand, are highly differentiated, non-dividing or post-mitotic cells. These characteristics make them highly radio-resistant, which meaning they are least affected by radiation exposure, even when bone marrow is targeted. Hence, despite exposure, neuronal structures remain relatively unaffected unless exposed to a very high doses or over extended periods. Okay. Continue with next question, Dr. Sinchan, Dr. Amrita.
Question 21. What is the SI unit of ionizing radiation dose used to measure the amount of energy absorbed per unit mass of tissue? A, Gray. B, Sievert. C, Becquerel. D, Roentgen. E, Curie. SI unit of ion.
E, Becquerel.
Becquerel. C, Becquerel.
No, they are asking the ionizing radiation dose used to measure the amount of energy absorbed per unit mass of the tissue. How much is absorbed by the tissue?
Gray.
So that is gray. That is gray. Okay. So gray, there are different units for various aspects of radiation. Gray is the SI unit for absorbed dose. That is the amount of radiation energy absorbed per kilogram of tissue. Okay. So 1 gray equal to 1 joule per kg. Then the other is a Sievert, SV, measures biological effect of the absorbed radiation dose equivalent, considering radiation type and tissue sensitivity. Third is a Becquerel, that is BQ, SI unit of radioactivity, that is disintegration per second. Okay. And Röntgen and Curie are not used. They are older non-SI units. Okay. Used historically. In clinical and radiological practice, gray is the correct SI unit to quantify the absorbed radiation dose. So please remember what exactly is asked in the question. Okay. Because options will be same. Just, one or two words will change your answer. So read the question properly. Next, Dr. Sinchana, start.
Yes, sir. Which ECG leads are primarily used to determine the electrical axis of the heart? Lead 1 and 2, 2, 3, lead 1 and AVF, V1 to V6, AVR and AVL. Lead 1 and AVF, C.
Yes. So electrical axis of the heart is determined by the lead 1 and AVF. Okay. Next.
Prolongation of QT interval is associated with increased risk of which of the following arrhythmias? A. Atrial fibrillation. B. Torsades de Pointes. C. Supraventricular tachycardia. D. Sinus bradycardia. E. Ventricular bigeminy. Prolongation QT.
Prolonged QT interval. Which arrhythmia? It is B. Torsades de Pointes.
Torsades de Pointes.
Yeah. So question number 22 is C, leads 1 and AVF. The QRS complex is typically assessed using lead 1 and lead AVF. The direction and positivity or negativity of the QRS complexes in these leads help classify axis normal, left, right, or extreme deviation. Question number 23, answer is B, that is Torsades de Pointes. Explanation is a prolonged QT interval may predispose to this particular arrhythmia, a form of polymorphic ventricular tachycardia that can lead to sudden cardiac death. Okay, so prolonged QT interval, remember Torsades de Pointes. Okay, continue with the next two questions.
Which of the following is the most characteristic ECG finding in hypokalemia? Tall peak T waves, flattened T waves and U waves, shortened QT interval, ST elevation, broad QRS complex. B. Flattened T waves and U waves.
Correct. Flattened T waves and U waves in hypokalemia. Next question.
Which of the following is the earliest ECG change in hyperkalemia? Prolonged QT interval, flattened P waves, tall peaked T waves, ST depression, Q waves in anterior leads, tall peaked T waves in hyperkalemia.
Correct. Okay, so electrolyte imbalance, and they may give you some ECG also, and they may ask you what exactly is the problem diagnosis and all. Okay, so question number 24, answer is C, that is flattened T waves and U waves. In hypokalemia, ECG changes will include flattened or inverted T waves and appearance of U waves and possible ST depression. Severe hypokalemia may lead to arrhythmias. Okay, so hypokalemia, flattened T waves. Hyperkalemia, tall T waves. Okay, so question number 25 is a tall peaked T waves. Tall narrow peaked T waves are the earliest sign of hyperkalemia, typically best seen in precordial leads. As potassium rises, P waves flatten, QRS widens and can progress to sine wave pattern. Next question, Dr. Amrita, take these.
Yes, sir. Question 26. Yes, sir. Question 26. Which of the following ECG changes is commonly seen in hypercalcemia? A. Prolonged PR intervals. B. Prolonged QT intervals. C. Shortened QT interval. D. ST segment elevation. E. T wave inversion.
Short QT interval.
Shortened.
Potassium we saw. Now here hypercalcemia will affect QT interval. Okay, then hypercalcemia, increased calcium will lead to shortened QT interval. Okay,
shortened QT interval.
Okay, so
question.
Yes. Yeah.
Question 27. Which of the following ECG changes is characteristic of hypocalcemia? A. Tall T waves. B. Shortened PR interval. C. Prolonged QT interval. D. ST elevation. E. Wide QRS complex. Sir, C.
Prolonged
Prolonged
QT
QT interval.
Yeah. Okay, prolong, opposite. Okay,
Yes.
so calcium is
Opposite.
reduced, QT will be prolonged. Okay, so question
Okay.
number 26, shorten QT interval. Hypercalcemia leads to shortening of the QT interval due to accelerated ventricular repolarization. It may be settled and requires close inspection. Then question number 27, answer is C, prolonged QT interval. In hypocalcemia, there is a prolonged QT interval primarily due to prolonged ST segment. It increases the risk of ventricular arrhythmias. Yes. Next two questions, Dr. Amrita.
Question
Please.
28. Which of the following ECG findings is most consistent with atrial fibrillation? A. A regular narrow QRS rhythm with sawtooth flow waves. B. Irregular rhythm with absent P waves. C. Broad complex tachycardia. D. Peaked P waves in lead 2. E. Fixed PR interval with grouped beats. Sir, option B. Irregular rhythm with absent P waves.
Absent P waves and irregular rhythm. Next question.
Yes. Question 29. What does the P wave ECG represent? A. Ventricular repolarization. B. Atrial repolarization. C. Atrial depolarization. D. Ventricular repolarization. E. AV nodal delay. So, atrial depolarization.
Correct,
C.
correct. This is also asked question. Okay. So question number 28, B, irregular rhythm with absent P waves. Atrial fibrillation shows no identifiable P waves, irregular ventricular rhythm, and narrow QRS complexes unless with a bundle branch block or pre-excitation. Question number 29, answer is C, atrial depolarization. The P wave represents depolarization of the atria initiated by sinoatrial node. Dr. Sinchana, continue with all next questions.
Yes, sir. The QRS complex corresponds to which of the following electrical events in the heart? Atrial repolarization, atrial depolarization, ventricular depolarization, and ventricular repolarization, SC node firing. Ventricular depolarization, QRS.
Correct. Correct. Next.
What does the RR interval on an ECG mostly directly measure? Duration of atrial contraction, ventricular repolarization, heart rate, PR interval, QT interval. C, heart rate.
Correct. Correct. So question number 30, it is a ventricular depolarization. The QRS complex represents the rapid depolarization of the right and left ventricle. Question number 31 is answer is C, heart rate. The RR interval is the time between two consecutive R waves and is used to calculate the heart rate. Continue. Next question.
Which of the following is the most typical ECG finding in an acute inferior MI? ST elevation in V1 to V4, ST elevation in S23 AVF, ST depression in 2-3 AVF, ST elevation in 1 and AVL, T wave inversion in V5 to V6. It is ST elevation in 2-3 AVF.
Correct. Inferior
Yes.
MI is 2-3 AVF. Okay. ST elevation 2-3 AVF. Next.
What is a possible ECG finding in a patient with pulmonary embolism? ST elevation in anterior lead, peaked T wave, S1Q3 T3 pattern, PR segment elevation, complete AV block. C, S1Q3 T3 pattern in pulmonary embolism.
Correct. Pulmonary embolism S1Q3 T3 pattern is seen. Okay. So question number 32, answer is B, ST elevation in 2, 3 and AVF. Okay. Inferior myocardial infarction, inferior wall typically presents with ST elevation in leads 2, 3 and AVF, indicating infarction in the inferior wall supplied by the right coronary artery. Question number 33, it is S1Q3 T3 pattern, a classical though not always present finding in pulmonary embolism is the S1Q3 T3 pattern, a deep S wave in lead 1, Q wave in lead 3 and inverted T wave in lead 3. Okay, S1Q3 T3 pattern is correct. Okay, so that finishes today's module of biophysics. Okay, thank you.